You've just had your C-section surgery not too long ago, and your doctor has told you to get outside and start moving your body and start walking. And all you can think of is, oh my gosh, how far do I go? How often do I do it? How many times a day? How do I know if this is too much for my body? What are some signs that I'm overdoing it? And what in the world does just listen to my body mean anyway? Walking after C-section surgery, I'm breaking it down for you in today's video. Welcome back to the Strong Mom Channel, moms. My name is Denise, personal trainer and holistic nutritionist, helping you to get strong from the inside out after having a C-section surgery. And if you're new here, welcome. Hit the subscribe button, hit the notification bell so you never miss one of my C-section workouts. Now today we're talking about walking in the immediate post C-section surgery. This is between 1 week and 8 weeks post-op, before your doctor has given you the all clear to do exercises again. Now, if your doctor has already given you the approval to go ahead and exercise, this video probably isn't for you. However, I have a 5-part video series all about the who, what, when, where, how, did I miss any, of exercise after C-section. So I want you to check that out there. I will link all 5 videos down below for you. So this outdoor walk that your doctor has suggested is not for weight loss. It's not to get back into exercise mode. It's to get your body moving again, to increase your energy, to get your blood flowing, and to slowly and gradually get your body walking at a pace that's normal for you. So, how far do I go? Here's what I suggest to you. Walk 2 houses, maybe 3 houses down the street, and then make your way back. Maybe that's enough for the day, but maybe you can do more. Walk a couple more houses down the street and walk a couple houses back. There's no magical distance that you need to work up to or start at. Your ability today might be less than your ability tomorrow. And it's important to note that C-section recovery is not linear. And by that, I mean your healing does not look like this. Instead, your healing might look like this. You might feel energized today and be able to go for a longer walk. Tomorrow, you might have had the worst sleep ever, and you might not even be able to go for a walk. So I want you to remember to take it one day at a time, to take it slow, and remember you are still recovering. And the main thing that you need to be doing during this time is resting and moving very gently. Just know this, that if you do too much too soon, it will delay your healing process. I remember about a week after my daughter was born, I birthed her vaginally and I was ready to go out. I was ready to go to the mall. And so we went out on our first outing with our brand new baby. And I walked around the mall, which was about 1.5 kilometers, so almost 1 mile. I had no problem doing it in the moment, but the day after, I was so wiped and my body was not ready for it. My brain was telling me yes, but my body was telling me no. I want you guys to comment down below and let me know if you've ever experienced a time like that where you totally overdid it and your body was not so happy with you. The other thing that you might hear is people telling you, just listen to your body. You'll know what to do. But our bodies don't talk, so how are we supposed to listen to our body? What does that even mean? As I said, start slowly, but listen to the cues that your body gives you. So for example, while you are walking, maybe it's that first walk, and you walk 2 houses down the street, I want you just to take note inside your body. How are you feeling? Does it feel amazing to be out? Or are you like, oh my gosh, every step I take, I'm in pain. I don't want to do this, right? If you don't want to do this, you probably shouldn't be doing this. If you feel amazing, then this is probably a good thing for you. A few hours after your walk, how are you feeling? Did it totally wipe you out for the rest of the day? If that's the case, then your walk was too much for you. And I would suggest doing a little bit less the next day. Another indicator is pain. On a scale of 1 to 10, 1 being no pain to very little discomfort, and 10 being excruciatingly painful. How much pain do you have during your walk, after your walk, or the next day? Did you experience pain in your incision? Did you experience pain in your back or anywhere else in your body? If you're around a range of 1 to 3, then you're probably good to go and continue walking. If you're anywhere higher than that, then I'd say slow it down and reduce the distance, reduce the time that you're walking. Another way you can tell if your walk is too much for your body is by checking in with your lochia. And lochia is the blood that's being shed from the inner lining of the uterus. And that happens about up to 6 weeks, give or take, after your surgery. Did walking create excess lochia? If you have more lochia today than yesterday, then maybe your walk was a little bit too much. I know these are still very subjective, but only you know your body, and you will know how much is enough for your body. Not your surgeon, not your best friend who also had a C-section, you. I want you to honor that and resist the temptation to compare your C-section healing journey to somebody else's healing journey. Now, mamas, go outside, listen to your body, listen to these cues, and enjoy walking and moving your body again. And make sure to stay tuned, because in the next few weeks, I'll be creating for you a post-C-section indoor walking workout. Make sure to grab your Flat Belly After Baby ebook, 10 holistic ways to get a flatter belly without surgery, without diets, and without extreme exercise regimes. If you're looking for a proven path to get from where you are today to safely working up your core strength and your full body strength so that you can get back to doing the things, the activities, the exercises that you were doing before pregnancy or before your C-section, then click the Work With Me link down below. Let's set up a time to chat and see if we are right to work together in virtual online training. Ladies, thanks so much for joining me. I will see you in the next video, and please make sure to comment down below. I create these videos based on what you guys are asking me and the questions you have. So the more questions, the more I can answer you in these videos. So leave that down below. I will see you in the next one. Bye.